Shifting gears quite a bit now, let's explore gambling-related harm. This is a significant public health issue, and one that frequently coexists with mood disorders and anxiety, things we've already touched on. Our sources highlight that routine screening for gambling, alongside other addictive behaviors like alcohol or drug use, is actually recommended for all new patients, and maybe opportunistically for others. How do you approach this screening in a sensitive way in practice, given the high level of stigma often associated with gambling problems?
Yeah, this is vital because these disorders are common, they often coexist, and that stigma makes people incredibly reluctant to disclose gambling issues voluntarily. So imagine a patient who comes in, maybe presenting with unexplained financial stress, or perhaps recurrent anxiety or low mood without a clear cause. How do you gently pivot the conversation to explore gambling as a potential underlying factor? Our sources recommend using a very simple, brief, two-item screening questionnaire if a patient discloses any gambling, or perhaps if you have a suspicion. Things like the brief problem gambling screen, the BPGS-2 for adults, or the LIBET screen for young people, they're quick and easy. A yes answer to just one of those questions warrants a bit more evaluation.
Okay, and for that further evaluation, once a potential problem is flagged by that initial screen, what's the GP's next step then?
The next step would usually be using a slightly more detailed tool like the Problem Gambling Severity Index, the PGSI. It's a 9-item questionnaire that helps assess the severity of the gambling problem. A score of 3 or more on the PGSI generally indicates a need for referral for more specialist assessment and help. Which brings us to intervention. The first step is always establishing that therapeutic relationship, offering hope, showing you're there to help without judgment. Brief interventions, often using principles of motivational interviewing, can actually be quite effective in reducing gambling behavior in the short term, and importantly, preparing patients to accept specialist assistance. Referral to dedicated gambling support services is crucial for anyone with concerns or a positive screen. These services can provide assessment, connect individuals to local support, things like financial counseling, which is often needed, and facilitate peer or family support groups.
And for treatment itself, what options are available for gambling disorder?
Specialist psychological therapies are the mainstay and are highly beneficial. Cognitive behavioral therapy, CBT, is recognized as the most effective evidence-based treatment for gambling disorder. Motivational interviewing is also shown to be very effective, either as a standalone or as part of CBT. It's important for you to know that currently no drugs are TGA approved specifically for treating gambling disorder here in Australia. Though naltrexone, an opioid antagonist, has some limited evidence suggesting it might help reduce gambling urges in some people, it should really only be used as an adjunct treatment under specialist guidance. And as always, remember to screen for and manage any co-occurring mental health conditions or substance use disorders because they so often go hand in hand with gambling problems.